Dato, of the number of patients in the ICU or on ventilator right now, how many have recovered and how many have died?
So from ICU, we're just looking at percentage. So out of the total percentage that we have today, if you were to look into our cases, we have 4,346. 4.9% of them been managed in the ICU. And the mortality, as I mentioned earlier, is about 1.6%, so you can do the calculation there. So the rest, discharge is about 40%, 30 to 40%, so that is our discharge. But some of them are already out of ICU but still been managed in our COVID ward until they are negative for more than 24 hours. So if their test is negative more than 24 hours, then only we discharge them. So the reason is now if you were to look into the cases that have been discharged, almost about 42.1% from the ward. So out of 1,830 cases, our discharge rate about 42%, 42.1%.
This is from the ICU, right?
Yeah. No, this is our total cases. ICU is only 5%. You can do the calculation there from 5%, 4.9% to be precise. So you calculate 4.9% of the total been managed in ICU, and the mortality is 1.6%, right? So you can calculate from there, and discharge from that group about 30%, 30 to 40%, but the rest are still managed in the COVID ward.
From the statistical data, we found that in Malaysia there's less patient in ICU and much more less number in fatality. So could you share the Malaysia's experiences?
So far, we look into our cases now. Again, are we looking into different strain of COVID-19? And it's been reported there were S strain as well as the L strain. So again, we need to isolate the virus to study our virus of COVID-19 in this country. So that process is ongoing. But more importantly, if we were to look into the different strain of the virus, then we will take time for us to come up with the research and identification. It's very challenging for us in this period of time. And looking into the cases, definitely the cases are slowing down. But what's more important that our cases, 88% of cases have positive and mild symptoms, 88%. But we are not sure of this 88% which patient will eventually becomes moderate or critical. Therefore, positive patient being observed in our ward in the hospital. Then, when we look into the utilization of ICU, we also realize that only 5% or 4.9% to be precise needs ICU management. And as compared to other countries, maybe 10% or maybe more than 10%. So it's only 4.9%. And out of this 4.9%, needing ventilation is actually less than that. So we don't know what we are looking at. Is it because we are looking into different strain of virus? We don't know, right? Unless we have isolation, then we can actually study the behavior or nature of the virus, whether it's S strain or L strain, as we mentioned earlier. But what we do know is that our utilization of ICU less than 5%. Perhaps because we manage the patient early, meaning we detect the patient early, and before they have symptoms, we already admit them to the hospital. So only a few countries, one of our services that when you are positive, our ambulance will come to your home and then pick you up and send to the hospital. Then, although you have no symptoms, but the test shows that you are positive, we will isolate you and then we will treat you. So we will manage you in our hospital and ward and observe you closely. And before you deteriorate, we already know when, and then we will do the appropriate treatment for you. And also, I must admit that our intensivists, our anesthetists in the ICU, they're performing a brilliant job in terms of treating the patient. And as I said again, all our ICU beds, we have increased the capacity. 7 hospitals, COVID hospital, ICU from 44 beds, we can increase to 112 beds. And we also have 65 specialists from the private sector join us in the public sector during this period of time. And we have 909 nurses joining us as well from the private sector, or those who have retired join us to provide the services. So we have a good teamwork, and especially ventilators. We have 70 ventilators from the private sector loaned to the Ministry of Health. As far as ventilators, we have more than 956 ventilators available. So we do not have shortage of ventilators at the moment. And from the engineering department, I'd like to thank the engineering department and those involved. They come up with innovation. One ventilator can be used for 2 patients. So with that, we have increased the capacity of ventilators of 100%. So again, we also rely a lot of innovation in our setup, and this is a good positive innovation, and also our expertise. Do not forget, the most important asset of any organization, especially in the Ministry of Health, is the human resource. So our doctors are trained to do so, and I'm sure that our doctors are able to handle.
Apa SOP KKM gunakan untuk pantau pesakit-pesakit yang dah discharge dan pulih, memandangkan dekat DG CDC, Korean CDC ada mengatakan 51 foreign patient dia dijangkiti semula.
Jadi sebelum pesakit kita dibenarkan balik, kita akan adakan counselling walaupun dia dah negatif 2 kali dalam tempoh lebih pada 24 jam, dan sebelum kita balik kita juga akan memberi counselling kepada mereka, iaitu pertama mereka kena amalkan social distancing, dan kedua sentiasa mencuci tangan, dan ketiga cuba elakkan public gathering dan sebagainya. Jadi counselling tu kita maklumkan kepada mereka, mereka boleh dijangkiti kembali. Walaupun biasa dia kita lihat mereka walaupun dah dikesan antigen tu negatif, ada kalanya antibody itu tak cukup. Dia ada antibody tapi tak cukup untuk mereka kalau dijangkiti semula. Jadi the antibody is not protective yet. So kadang-kadang kalau kita lihat, kalau kita dah dapat immunization dan kita kena ada booster untuk dapatkan antibody yang lebih, jadi ada kemungkinan mereka akan dijangkiti, tapi peratusan jangkitan semula tu tak tinggi. Jadi kita harap mereka dapat mencegah daripada dijangkiti, daripada merawat ketika dijangkiti. Kita ada follow up macam biasa. Kalau yang mereka daripada luar negara, jadi tak ada follow up lah. Contohnya Bainan Regional kita dah discharge. Jadi daripada 416, biasa dia kalau kita dah detect positif, kita akan maklumkan International Health Regulation negara berkenaan. Contohnya kalau kes satu positif, Malaysian positif di Brunei contohnya, mereka akan maklum pada kita. Sama juga kalau kita dalam jemaah tabligh hari itu ada 25 negara, kita maklum pada 25 negara, the IHR tu. Sama juga kalau 416 kes yang positif, kita maklum pada IHR, International Health Regulatory Committee di negara masing-masing, mana mereka dikesan positif di sini. Jadi itulah kerjasama erat antara Kementerian Kesihatan, iaitu IHR. Kita pun ada International Health Regulatory Committee di Kementerian Kesihatan, dan ini dikelolakan oleh WHO. Jadi kita ada rangkaian network, rangkaian kerjasama International Health Regulatory dapat di bawah payung WHO. Kalau pasien ada jangkiti segera, kita ada follow up ataupun susulan melihat sakit kembali, dan kita akan lihat sama ada perlu atau tidak ada gejala kembali, dan kita monitoring lepas kita discharge daripada ward.